So Shaheen, can you explain to us what the successful diagnosis and treatment of endometriosis can actually mean for the patient?
Well, I think the most important thing that an early diagnosis will mean is that a person's quality of life will improve. And we need to remember that we're talking about women who are supposed to be enjoying a full life at the time where they want to start a family, build a career, have a good education. And every day that we can give back to a woman who's suffering by an early diagnosis is a day that is worth saving, if that makes sense. So that's the main reason to have an early diagnosis, rather than leaving someone to suffer for years and years before we have an answer. But there is also the argument that endometriosis is thought to be, not in all cases, but in some cases, a progressive disease. So the more you leave it and the more you leave it untreated, the more likely it is that it will then become so severe that more drastic actions are needed to remove the disease. So, for example, in extreme cases, endometriosis can compress the ureters. These are the tubes that bring urine from the kidneys to the bladder. And if we miss that and they continue putting pressure on the kidneys, that can potentially have very important effects on a person's health. These are the main two reasons to want to reduce the length of the delay in diagnosis.
And I think if I can add to that, Shaheen said really well from the medical perspective. From a person's perspective, if they've got the disease, the other thing is, if you don't have a name for your condition, you can, and you're missing school, your parents might get fined. If you're missing work, you're being told that you don't have linked conditions, so you're just having too much time off. So it can have that real impact. And certainly from research we've done, we found that 95% of women feel that endometriosis has negatively affected their well-being. And of course, if you've got people not believing your levels of pain, then that can have a real impact on your own confidence and anxiety levels as well.
And again, if I may come back, I just remember the very sad story of something one of my patients told me once. And she said, I wish I had cancer as opposed to endometriosis, which was shocking. I asked her why you say that. And the answer was that at least people understand cancer. I can go to my employer and say I have cancer. They would understand. They would be willing to help. My partner will understand that. My family will understand that. But I have chronic pain. Nobody knows why, and they think I'm just a wuss, as Emma earlier said. So these are the things that make the whole story around endometriosis much more complicated.